So we'll start with the second presentation, second abstract, which is nursing practices associated with nosocomial anemia among critically ill patients, which means that what is causing anemia in these sick patients, and it's presented by Dr. Fatima Rifat Al-Ahmed, which is affiliated. I think she's currently in Sharjah, as well as appointed in Iskandaria, and also with cooperation of Umm al-Qura University. So we'll start with the nursing causing anemia, not the physicians.
Thank you, Doctor, so much, and thank you for the organization committee for their efforts. And I'd like to say that I'm so happy to be part of this mega congress. Okay, my title today is about nursing practice association with nosocomial anemia among critically ill patients. Critical care nursing is a specialty concerned with human response to life-threatening problems. As well as at the same time, we are the nurses, we have an important role to prevent the acquired complications or nosocomial complications that may acquire during the patient stay in ICU. It's time now to transform the healthcare structure from a disease management industry to healing system. So the goal of critical care must extend beyond the patient survival and include shared multidisciplinary collaboration to prevent and manage the long-term complications of critical illness. Critical ill patients are at high risk already for complications due to several factors. Serious acquired complications that potentiate harm or actually cause harm are common in critical care setting. For example, venous thromboembolism, nosocomial infection, medication errors, falls, pressure ulcers, VAP, and nosocomial anemia. Then what we mean by nosocomial anemia? Nosocomial anemia is the actual reduction in total number of circulating erythrocytes, or a decrease in the quantity or quality of hemoglobin induced by multiple etiologic factors. By the way, the nursing practice is one of these etiologic factors. Values less than 12 gram per deciliter in the male and 10.6 gram per deciliter in the female are considered anemia in our study. Nosocomial anemia, because of its associated morbidity, mortality, is of clinical importance in critically ill patients. Actually, nosocomial anemia can lead to negative impact on different body systems, and also can result in increased risk of morbidity, mortality, and generalized decrease in oxygen carrying capacity. Organ failure can lead to increased length of ICU stay, increase the need for blood transfusion, and at that point of time, exposing the patient to transfusion complications. In critical illness, nosocomial anemia results from two fundamental processes: RBCs loss and RBCs production. Decrease the RBCs production. For the critical care nurse are advocates for patient safety. So nurses have an important role to prevent such complications through minimizing the blood loss through blood sampling, in addition to using of blood conservation strategies. All of these nursing practices that can save the patient's blood. So this study aims to determine the association between nursing practice and nosocomial anemia among critically ill patients. And we used the descriptive correlation of design to conduct this study. And this study was carried out in 2 ICUs in the main university hospital in Alexandria, Governorate, Egypt. And we included conveniently 65 newly admitted adult critically ill patients, in addition to all nurses who are working in these 2 intensive care units. 3 tools were used in this study to collect data, and after getting the administrative approval, needed to collect data. Pilot study was carried out and data collection has been done. So, related to the result, the main result, I'd like to show you the main result of this study because of the time limitation. 76.9. Yeah, around 100% of the critically ill patient or of a studied patient developed nosocomial anemia, acquired anemia during their stay in ICU. And 40% of them developed this anemia after only 3 days of their stay. And for those who not developed nosocomial anemia, the non-anemic patients, they experience a change in their hemoglobin level. This change, 40% of them had experienced a change in their hemoglobin level by 2 to 3 grams per deciliter. And related to the adequacy of practice related to withdrawing the blood sample, it was 82.75% related to the arterial puncture and 0% related to the post-care and documentation and assessment. And in terms of the main sampling blood loss volume associated with laboratory tests among the studied patients, it can be shown from these tables that the blood gas analysis has the highest sampling blood loss volume among chemistry, hematology, coagulation laboratory tests. And according to the distribution of studied patients with the invasive lines, main volume of insertional blood loss, this table shows that 11.6 milli of blood lost during insertion of central venous catheter. That's why it's we can see from these tables that the occurrence of nosocomial anemia was significantly associated with the main sampling blood loss volume for patients during their stay in ICU. So we can conclude that more than 3/4 of patients developed nosocomial anemia during their ICU stay. Even non-anemic patients were subjected to a decrement in their hemoglobin level. And regarding the increased application of factors, the volume of blood withdrawn for laboratory test was much more than the required volume, which resulted in iatrogenic blood loss. Therefore, quality improvement project standards or policies should be developed to prevent nosocomial blood loss for patients during their stay in ICU. So we would like to recommend the use of correct technique for venipuncture, arterial puncture, considering blood-saving bundle, schedule and clusters required the laboratory test, develop a quality improvement project standards or policies to prevent nosocomial blood loss, formulate guidelines for charting system and documentation, and finally including hematological assessment as a part in the nursing team. Thank you.